Bismillahirrahmanirrahim. Quote of the day: the bravest heart is the one that says close to Allah, even when it is in pain. Today, the topic of presentation is decision making in health system. SWOT analysis. I am Dr. Iqbal, PGR Community Medicine, and I am presenting under the supervision of Professor Dr. Saira Afzal, Dean, Institute of Public Health, Lahore. Learning objectives of today's presentation is introduction to decision making, SWOT analysis, component of SWOT analysis, 7 rules for SWOT analysis, uses of SWOT analysis, advantages and limitation, recent advances, and MCQs at the end. Learning outcome: by the end of this presentation, participant will be able to understand SWOT analysis, its component and uses. So the introduction: in decision making in the health system is a systematic process of identifying problems, generating alternatives, evaluating options, and selecting the most appropriate course of action to improve population health outcome. It aims to achieve equity, efficiency, effectiveness, quality, financial protection, and sustainability. So why decision making is complex in health system? Health system are complex adaptive system because they involve multi-stakeholder, limited financial resources, political influence, ethical consideration, epidemiological transition, demographic pressure. Decision must balance technical evidence and political feasibility. So we will discuss SWOT analysis. SWOT analysis is the strategic plan and strategic management technique used to help a person or organization identify strengths, weaknesses, opportunities, and threats related to health competition or project planning. It is sometimes called situational assessment or situational analysis. This technique is designed for use in the preliminary stage of decision-making processes and can be used as a tool for the evaluation of strategic position of organization of many kinds, from profit enterprises, local and national governments, NGOs, etc. It is intended to identify the internal and external factors that are favorable and unfavorable to achieving the objectives of the project. User of SWOT analysis often ask and answer questions to generate meaningful information for each category to make the tool useful and identify their competitive advantages. So these are the components of the SWOT as a strength, which include things your medical business does well, qualities that differentiate you, internal resources such as skilled staff, intangible assets such as brand loyalty follower. Weaknesses, which include things your business lack, things your competitor do better, resource limitation, unclear unique selling proposition, or lack of established brand. Opportunities: underserved market for specific service, few competitor in your area, emerging need for the service line. Press media coverage on your practice. Threat include rising competitor, changing regulatory environment, negative press media coverage, changing patient attitude towards your practice. So, strength, which is the internal positive factors within the health system that support effective decision making, a new or innovative service capability or cost advantages, cultural correction, extraordinary reputation, other aspects that add value, special expertise and experience, superior location or geographic advantage, unique value that drive your health management information system. Now, next is the weaknesses, which is the internal negative factor, internal gap that weaken the decision making, absence of proper planning, damaged reputation, gaps in capability or service area, lagging in technology, management and staff problem, unknown vulnerability, poor location or geographic barrier, undifferentiated service line. So the opportunities, which are the external positive factor, external condition that can improve decision making, a market affected by competitor, availability of a new technology, change in population profile or need, competitor vulnerabilities, lack of dominant competition, new healthcare segment that offer improved profit. So threat, which is the external negative factor, a competitor has an innovative product or a service, a competitor in the health sector, uh, adverse changes in the reimbursement or regulation, changing insurance plan and contrast for the major area employers, competitor have superior access to channel of distribution. So the rules for SWOT analysis, there are seven simple rules for a successful SWOT analysis, which include number one, be specific, avoid gray areas, vague description or fuzzy definition. Second is the be objective, ask for input from a well-informed but objective third party. Compare it with your own notes. Third is a be realistic, use a down to earth perspective, especially as you evaluate strength and weaknesses, and be practical in judging both sections. Fourth is apply context, distinguish between where the organization actually is today and where it could be in future. So rule number five, contrast and compare, analyze in relation to your competition that is better than you or worse than your competition. Short and simple, avoid needless complexity and over analysis. Seven, update your marketing plan and goal. Once the key issue have been identified, define the action step to achieve changes. So next is SWOT strategy canvas. SWOT strategy canvas track the impact rate of the each element of SWOT. The goal is to witness a low impact rate, weakness and strength, and the high impact rate of strength and opportunities. This is the SWOT strategy canvas. On x-axis, there is opportunities, weakness, strength, and threat. On y-axis, there is the impact rate, which is 0, 0.5, and 1. The blue line shows the strength and the weakness, and the red line shows the opportunity and threat. So this is the example SWOT, as hospital SWOT analysis, in which this is the internal positive factor, which is strength, established brand in the market, sport, buy in the farm, management, strong presence in the community, strong funding, partnership with public health. Weaknesses, which is the internal negative factor, high nurse turnover rate, competitions between hospital and the clinical limit effort to some degree, staff participation, bureaucracy and need for the brand culture. Next is the opportunities, which is broaden partnership, relationship, consistent message and program, technology upgrade, establishing great brand reputation, student in healthcare oriented to our organization, increase our branding efforts. So threat include internal misalignment between board member, lack of shared strategic vision, decision are disconnected, patient experience challenge that come with the expansion, decrease workforce. So this is the SWOT analysis of the health monitoring system. Strength include rise quality of the healthcare service by diversifying the capability of healthcare staff, strong advantage in the pandemic period, safe healthcare, providing personalized health performing and less intrusive healthcare, facilitating access to our information and the clinical research through cloud computing based service, means to improve the efficiency and effectiveness of the system and their control and reduce cost, continuously lowering the price of ICT technology. So the weaknesses are missing the information and the confidence in the health e, uh, e-health solution, missing of legal clarity for health and wellness specific mobile application, missing of transparency regarding the use of data collected by such app, frequent change in the management structure of Ministry of Health, missing of binding legislation on standardized framework, insufficient use of international standard. So the opportunities e-health monitoring system make it easy to stay in the familiar environment for a long-term socio-economic inclusion, quality of life, patient empowerment through the greater transparency, access to service information as well as use of social media in health. Possibility to use experience of EU member and WHO. So threats include high in upfront cost of setting up e-health system, regional difference in access to ACT services, and the disadvantaged region having limited access. Inadequate are the fragmented legal framework, especially in the area of e-health services where reimbursement system are in place. So this is the SWOT analysis of the healthcare system, and which strength includes specialized services, advanced technology, high quality care, strong patient relationship, and online presence. Weakness include staff shortage, outdated system, high turnover, lack of training, operational insufficiency. Opportunities include telemedicine growth, AI and digital health, personalized treatment plan, public and private partnership. So the threat include regulatory change, cybersecurity risk, Medicare cuts, and economic instability. So next is the uses of SWOT analysis. The SWOT analysis has been used in the community work as a tool to identify the positive and the negative factor within the organization, communities, and the broader society that promote or inhibit successful implementation of social services and social change efforts. It is used as a preliminary source assessing strength, weakness, opportunities, and threat in the community served as by a non-profit or a community organization. Next uses strategic planning. It helps organization identify the competitive advantages, recognize internal gap, align strategies with the environmental condition, set realistic goals. For example, before expanding primary healthcare service, what help determine whether the system has adequate workforce, infrastructure, or financial stability. Policy formulation, sport policy formulation in designing evidence-informed policies by analyzing institutional strength, implementation challenges, external socio-political environment, financial sustainability. It ensures policies are feasible, context appropriate, and risk aware. Next is the program development and evaluation. SWOT is used to design new program, assessing ongoing program, identify area for improvement. In the program evaluation, it helps understand why a program is succeeding, detect operational weakness, identify external risk affecting performance. Resource taxation organizations use SWOT to prioritize resource distribution. It helps in decision making, invest in high impact areas, strengthen weak component, avoid high risk investment. For example, in the health system with the limited budget, SWOT can help decide whether it invest in the infrastructure, workforce training, or digital health. Next is the risk identification and management. It helps to identify the internal risk, that is poor governance and weak monitoring, and external risk like political instability and economic downturn. Organization development, it helps in capacity building, leadership development, and institutional strength. Matching and converting. On one way of using SWOT is matching and converting. Matching used to find the competitive advantage by matching the strength to the opportunities. Another tactic is to convert weakness or threat into the strength or the opportunities. The conversion strategy is to find a new market. If the threat or weakness cannot be converted, a company should try to minimize or avoid them. Corporate planning, development of strategies and the plan to enable an organization to achieve its objective. That organization will use a systematic process known as a corporate planning, setting objective, define what the organization is going to do, environmental scanning, internal appraisal of organization, and assessment of the present situation as well as portfolio of the product, service and analysis of the product service lifecycle analysis of our existing strategies. This should determine relevance from the result of an internal or the external appraisal and may include gap analysis of the environmental factors. So the advantages of using SWOT analysis is it is a simple and easy to apply, flexible across sectors, encourage comprehensive assessment, support strategic clarity. So the limitation to use it can be subjective, does not prioritize automatically, require reliable data, may oversimplify the complex system. Therefore, SWOT should often combine with other analytic tools like cost effectiveness analysis and risk assessment. So next we come to the recent advances. This is the article published National Program of Family Planning and Primary Healthcare Pakistan, a SWOT analysis. Background of this is the National Program for Family Planning and the Primary Health Care was launched in 1994. It is one of the largest community-based program on the world, providing primary health care service to about 80 million people. The program has been instrumental in improving health-related indicator of the maternal and the child health in last 2 decades. So the method which is used was SWOT analysis. Um, uh, in which strength of the program include comprehensive design of the planning, implementation, and supervision mechanism. selection and recruitment process and evidence created through improving the health impact indicator. Weaknesses of include identified at a slow progress, poor integration of the program with the health services at local level, including miss and demotivational factors such as job insecurity and non-payment of the salaries in time. So the opportunities include further widening and coverage of the services, its potential contribution to the health system, research and use in the area other than the health, like women empowerment, poverty elevation. Threat include the program may face political interference, lack of funds, social threat, and implementation for the professional malpractice. So the conclusion of this was strengthening of the program with the necessities and strong political commitments, sustained funding, and remuneration to this barefoot doctor of Pakistan, the lady health worker. Next is the article, a SWOT analysis for ChatGPT implication for the education practice and research. ChatGPT is an AI tool that sparked debate about its potential implication for education. We use SWOT analysis framework to outline the ChatGPT strengths, weaknesses, to discuss its opportunities and threats to the education. The strength includes a sophisticated natural language module to generate a pulsable answer, self-improving capability, and providing personalized and real-time response. ChatGPT can assess the information, facilitate personalized and complex learning, and decrease teaching workload. Therefore, make a key process and task more efficient. So the weaknesses are lack of deep understanding, difficulty in evaluating the quality of response, risk of bias and discrimination, and lack of higher order thinking. Threat, threat to education include lack of understanding of the context, threatening academic integrity, perpetuating discrimination in education, and declining the higher order cognitive skill. We provide the agenda for the educational practice and research time of ChatGPT. Next is the SWOT analysis of the community midwife program in Pakistan. The community midwife program was launched in 2006 by the government of Pakistan. So the SWOT analysis used in which strength of the community midwifery program include enrollment criteria of the community midwife, extensive coverage of the midwifery service, management and supervision of the program, healthcare delivery, and positive effect of the program on the health indicator. Weakness include management of the program at the district level, weak management of the program at the district level, problem in funding, job insecurities of the community midwife, weak supplies of the equipment. Opportunities include communities acceptability, health system research, and support for the referral system. So the threat include financial affordability, social and cultural norms, funding problem, political and socio-economic environmental factor, non-acceptance by the established medical profession. The strengthening of the community midwifery program require more political commitment and proper integration into the existing health system of Pakistan. Now, come to the MCQs. MCQ number one, a district health officer has a well-trained epidemiological team but experience delay due to the poor data reporting software. In SWOT analysis, poor reporting software is classified as A, external threat affecting sustainability, B, internal weakness limiting performance, C, external opportunity for reform, D, strategic strength of system, E, political barrier to planning. A is
D.
the right, A is the right option. MCQ number two, a province must decide whether to invest in the workforce training or hospital infrastructure using SWOT. Help primarily to A, eliminate need for financial review, B, replace epidemiological assessment, C, prioritize high impact strategy option, D, remove political influence entirely, E, centralizing authority at a federal level.
C.
Yes, C is the right option. MCQ number three, during a dengue outbreak, the health department quickly mobilized field team due to existing surveillance network. The surveillance network represent A, internal organizational strength, B, external environmental threat, C, internal managerial weakness, D, external political opportunity, E, operational administrative delay. So A is the right option.
A.
MCQ number 4, a maternal health program show poor outcome due to weak monitoring and evaluation process. In short term, weak monitoring is A, external structural barrier, B, internal system weakness, C, external financial opportunity, D, political instability factor, E, operational field strength.
B.
Yes, B is the right option. MCQ number 5. Before expanding the primary health center, planner analyze workforce capacity and infrastructure gap that is reflect SWOT use in A, crisis media communication, B, strategic planning process, C, individual clinic audit, D, random policy experimentation, E, emergency epidemic response.
B.
Yes, B is the right option. MCQ number 6. The main limitation of SWOT analysis is that it A, requires excessive statistical modeling, B, eliminates need for stakeholder input, C, may oversimplify complex realities, D, replace evidence-based planning, E, prevent identification of risk. C is the right option. C is the right option. Limitation of SWOT analysis is it's oversimplify the complex realities. MCQ number 7. A district has limited fund, decreased burden, strong workforce commitment, and outdated equipment. Using SWOT prioritization, decision making should A. Invest in visible infrastructure expansion product, B. Strengthen existing workforce with initial equipment, C. Allocate funds equally across all departments, D. Reserve budget for unforeseen political events, E. Delay spending until external grant arrives.
B.
Yes, B is the right option. MCQ number 8. At which level would a decision to reconstruct national health financing after the economic recession primarily occur? A. Operational level of service delivery. B. Managerial supervision of district program. C. Strategic national policy level. D. Facility based quality assurance unit. E. Community level outreach coordination. C is the right option. MCQ number 9. SWOT analysis is a strategic planning and strategic management technique used to help a person or organization to identify various problems. Which of the following is correct description of the SWOT analysis? A. SWOT analysis summarizes the opportunities and threat for an organization. B. SWOT analysis summarizes the key issue and strategical capability of an organization. C. SWOT analysis avoid the need for evaluating strategic capability. D. SWOT analysis is a substitute for the environmental and the industrial analysis. E. SWOT analysis summarizes the strength and the weakness of an organization. B is the right option.
B.
MCQ number 10. Threat in the SWOT analysis are A. Internal technical capacity, B. External negative risk, C. Strong surveillance system, D. Skilled workforce availability, E. Clear policy framework.
B.
Yes, B is the right option. This is the answer key. This is a YouTube channel where this video will be uploaded. Thank you.
Thank you very much, Dr. Rabbia, for a very nice presentation. And the special important thing is that these strengths, weaknesses, opportunities